In this video, I'm going to teach you who should not fast. Hi, I'm Dr. Zarowski from NewVisionExcel.com. If you're new to the channel, it is such a pleasure to have you here. Be sure to subscribe, hit the little bell notification if you want to excel your health and your life, and you're going to be well on your way. In this video, we're talking about who should not fast. This is a burning question that we get a lot. Everybody, kind of presents all these different scenarios as to whether or not they should fast. And so I hope to kind of put this to rest with this video. The other thing about who should not fast is there's a lot of misinformation out there. So we hope to clear that up as well. Let's go ahead and start with adrenal fatigue. This is a common one. People say, I suffer from adrenal fatigue. Should I or should I not be fasting? So what I find with adrenal fatigue is that when people are having, this chronic fatigue issue, essentially what is happening is when they're fasting, they're just having all different types of symptoms. They're crashing really hard. They can even have some of the different symptoms down here like blood pressure and things like that rise. And so if you have adrenal fatigue, there's a couple things you can do. First of all, you can take a step back from fasting and you can work on, really boosting your adrenal function. And the other thing that you can do is while fasting is you can take an adrenal support supplement. We have one called Adrenal Revive. I'll put it in the comment section below. You can also take that while fasting to help keep your adrenals balanced. Now, while intermittent fasting, we don't see adrenal fatigue to be as much of an issue. When doing one meal a day, it can be a little bit more taxing on the adrenals, and you can see that symptomology start to appear when doing one meal a day. But overall, it's kind of hit and miss. So, stick to intermittent fasting, use an adrenal support supplement while fasting, and if you find that you're having a lot of different symptoms while fasting and some serious crashes, then maybe you should just take a step back from fasting and focus on your adrenal health first. The next big one is medications. So a lot of people ask about, very particular medications. Here's the thing. As a rule of thumb, while on medications, it is no, that you do not intermittent fast while on medications. However, if that is something that you want to look deeper into, what I always recommend is go to your managing doctor that you're working with and ask them if you can stay on that medication and fast at the same time. It is really their decision along with yours to determine if it is appropriate or not. So when it comes to medication, rule of thumb is no, but go to your managing doctor if you have more questions about that. Next is diabetes. So when you have blood sugar instability, diabetes type 1 or type 2, then it's going to be very difficult and challenging to fast. Now, rule of thumb with diabetes is a big fat no. However, when we have diabetes, what we should really focus on doing is reversing the diabetes. Now, type 1 is a different story. Diabetes type 2, in which I'm referring to, we should focus on reversing that or getting your body balanced out so that you're not having all those different blood sugar instability issues. So, fasting is one of those strategies that's kind of like above and beyond in order to help increase your level of health. And when you have diabetes, that should be the main focus, is to really work on reversing the diabetes issue, balancing the diabetes problem, the blood sugar instability, and then focus on fasting from there. Next one is blood pressure. One of the things that a lot of people will see is when they're fasting and they have high blood pressure issues is their blood pressure will actually rise while in a fasted state. Now, when we look at blood pressure, diabetes, adrenal fatigue, all of these combined together, this is something called metabolic syndrome. And when we have metabolic syndrome, or you have metabolic syndrome, what can happen is all of these things can flare up. Okay, we can have somebody with blood sugar instability, and during that fasting state, they're getting dizzy, their blood sugar is rising, their adrenals are just totally taxed, and it kind of all is combined together. So if this is you, then take a step back from fasting and focus on getting these conditions resolved, focus on getting these symptoms resolved, because here's the deal, is that fasting is one of those things that you do to take your health next level, maybe to lose some weight, to really do so many good things for your body. It has so many powerful benefits. If you actually haven't seen my video on the benefits of fasting, check it out. But fasting has so many powerful benefits, but if you have these issues, you need to take a step back and focus on your diet and making sure that that's clean, focus on reversing some of these different conditions and optimizing your health before you really try to go next level. Now, next on our list is, can women fast? This has actually been going around the internet that women can't fast and it's unhealthy for them, and it's couldn't be further from the truth. The truth is, yes, women can fast. And here's the deal. There's a couple of things that can come up when women are fasting. And once again, if you haven't seen my video on whether or not women can fast, check that one out because I give a little bit more detail on it. But women can fast just fine. Sometimes it can interrupt their cycle and sometimes it can interrupt fertility. Here's the deal though. Women typically only have issues with their cycle and fertility when they have very low body fat content and trying to fast at the same time. So as long as you're just, your typical average healthy woman, you should have no problems with fasting. If you're a woman who has very low body fat content, just like a female athlete, it can affect your cycle. But overall, women do just fine with intermittent fasting. Many times, one meal a day can be one of those scenarios that kind of causes more of the issues for women. And if that's the case, just back down from it a little bit and go more towards the intermittent fasting 16-8 rule. Nursing. So can you fast while you're nursing your baby? And the truth is that you want to stay away from that because here's the thing. When you are nursing, and let's talk about pregnancy too while we're at it, when you're nursing or pregnant, really number one is that baby. And we want to make sure that we take care of that baby and get the baby the nutrients it needs. When nursing, a lot of mothers, I know you have the baby and the first thing you want to do is get rid of those extra pounds. And so you look at things like intermittent fasting and dieting. But what happens is that you can first of all lose your milk supply, and second of all, you can actually become malnourished yourself and start not getting the baby the nutrients it needs. So when nursing, it's you can do some intermittent fasting, but you're going to want to really shorten those fasting hours because many women will suffer in their milk supply while fasting and nursing at the same time. Pregnant women, once again, is a big no, simply because you can create deficiencies in the body. When you're pregnant, it's very, very important to make sure you are not creating deficiencies because the baby needs them, and deficiencies and really essential nutrients like folate, for instance, can cause some very big issues with the baby, can cause all types of birth defects and that sort of thing. So we want to make sure that when pregnant, you are not fasting. It is not a good idea to do it at this time. There's a lot of other time in your life where you can focus on it. Pregnancy isn't one of them. Last on our list is malnourished. So if you are someone who is very thin, very frail, someone who is not eating a healthy diet, then you also should not be doing fasting. You've probably heard me in my other videos. It's very important to start with diet. And so if you're suffering from any type of eating condition, anorexia, bulimia, or any type of malnourishment through nutritional deficiencies, stay away from fasting until you work out those kinks. Once again, when we look at all these different things right here, it's very important to focus on a healthy diet. You've heard me harp on this so much that if you're going to do any type of fasting, you have to be following a healthy diet. And so be sure to focus on healthy diet, focus on reversing conditions, and then from there jump into fasting. And then for some of these other ones, like nursing and pregnancy, just completely stay away from them. So that is your guide as to who should not fast. Be sure to give this video a thumbs up, share it with your friends, subscribe below, and also check out my other videos on fasting. I have tons of great videos on fasting, giving you those answers you need. And until next time, folks, I'll see you in the next video.